Hi, everyone, and welcome to today's Impact webinar, Provider Intelligence, the Key Piece in Your Health Plan's VBC Puzzle. I'm Emma Nuckman, and I'll be moderating today's session, but wanted to acquaint you with a couple housekeeping items in the platform. Go ahead and open up that group chat tool that you see on your screen and tell us where you're joining from today. Keep the conversation going during the presentation and make sure that you ask any questions. Anything that we don't get to during today's live broadcast, we will follow up with after the fact. So go ahead and put those in the Q&A widget. We have some great related content pieces for you to look at, so go ahead and click on that on your screen and check out any of those items. So we have Leah, Peter, and Amy here today for a wonderful presentation. And Amy, I'll hand it over to you to get things started. So welcome, everybody.
Great. Good morning, everyone. Thanks for joining us today. I'm Amy Goodman. I'm here with my colleagues, Peter Manoogian and Leah Ventura. And we're really excited to talk to you today about value-based care and provider intelligence, and in particular through the lens of its strategic implications for health plans. So let's dive right in. To set the stage, likely everyone here would agree that value-based care momentum has been growing. From the early days of the Medicare shared savings programs established by the ACA, VBC models have proliferated across lines of businesses and are now commonly acknowledged as critical tools in the industry to drive higher quality care at lower costs. In recent ZS research as part of the HIMSS Trust, we found that almost half of health plan executives anticipated that VBC will represent 50% of total payments by 2025. And this is consistent with other reports we see throughout the industry, such as a catalyst for payment reform analysis. There's plenty of other evidence of the momentum as well, from CMS's launch of direct contracting models and their anticipated new mandatory models, to the growth that we see driven by health plan and provider partnerships in recent years, even with some recent specific collaborations around COVID challenges.
Yeah, but Amy, to that point, we still know there's a lot of opportunity for further evolution. Despite the large number of VBC contracts, the adoption rate of downside risk, or contracts in which providers stand to share loss with the payer, is much lower. And some studies suggest that only a third of ACOs even have a contract with downside risk, but we know that the results are there, especially during recent studies that have been published by CMS in driving downside risk adoption.
That's right, Peter, and that's a problem. And to your point, in that recent CMS study of 20 recent performance bonuses, 88% of those in double-sided risk models earn that performance payment, compared with only 55% of those on upside-only risk models. And there are a number of reasons behind the slower adoption of downside risk that we'll be unpacking today. Another big gap first that we see in the current state is that most of these models are primarily primary care oriented. Now, of course, in many ways, this is a good thing. PCPs can be the linchpin of good preventative care and care coordination and drive overall health outcomes in a population. However, as we know, nearly half of healthcare spending falls under specialist care, and specialist-based programs are few and far between. We see an opportunity to innovate beyond bundled payment programs for specialists to engage them more fully in new and innovative ways. Meanwhile, value-based care is a critical lever for health plans to achieve their strategic objectives, namely bending the cost curve while maintaining high quality care and demonstrating that value to employers, as well as differentiating themselves in the provider market. Yet, as we'll be discussing today, we see critical gaps in the type of trust and collaborative relationships between payers and providers that's really needed to be able to fully deliver on the value of value-based care. Health plans can and should do more to move the needle and fill those gaps. And today we're going to share our thoughts and two specific ideas around provider intelligence and engagement that we think health plans can take to drive those types of partnerships and truly advance along the value curve. I'm going to pass it to Leah to set the stage.
Great, thanks, Amy. So we believe that defining strategic health plan moves begins with really understanding provider barriers to adoption, as well as their desired support. So in the same research the F conducted earlier this year as part of the HIMSS Trust, We surveyed health plans on their views of current provider barriers to VBC engagement, as well as their anticipated challenges through 2025. And in line with provider report, health plans also raised lack of trust and understanding of risk-based agreements as a top barrier today. But we're under the impression that this barrier will decrease over time. So respondents were optimistic looking to the future, but it makes us wonder what stakeholders believe will change to drive these new levels of trust and understanding between the payers and providers. We would argue that the onus is on the health plans to make the investments that result in increased trust and understanding. It's not just going to happen overnight without concerted effort. So what kinds of investments should health plans be making to engender this trust? Well, there are a lot of new capabilities that providers have not historically had in-house that are necessary to really effectively manage population health. These include things like data and analytics, strategic updates to workflow, embedded technologies to coordinate care without extra administrative burden, and the pro forma visibility to anticipate how to do well financially under a value-based care contract. Health plans can bring these capabilities to the table in their VBC arrangements. And we see plenty of examples of co-investment and enablement, including Blue Cross Blue Shield Minnesota, Care First, Humana, many others. So we believe this type of collaboration is critical to build trust and capabilities that are necessary for providers to take on downside risk. So I know we said a lot so far. Let me pause here and see if there's any questions or comments from the group on provider needs as they relate to value-based care engagement and the role health plans can play in facilitating these capabilities.
Perfect. Thank you, Leah. We actually do have a question. Someone's asking, do all providers feel the need to get these capabilities? And what about those who are holding on to fee-for-service for as long as possible?
I can hop in here. So yes, certainly as we look across the country, there is a big range in the maturity of markets in their move to value-based care. When we talk to clients in California or the Pacific Northwest, many of them have been at this for decades, and this is old hat in many established successful models. In other markets like Phoenix, they are holding on to, many specialists are holding on to fee-for-service, for as long as possible, and there's more resistance to the ideas about this collaboration. But ultimately, my mind goes back to a conversation we had with a clinical leader of a mid-sized health system who said, value-based care is coming. Either get on board or be left behind. If you're not ahead of the train, you're under it. And that summarizes our view that on the balance, providers see that it is coming. It's not if, but when, and are looking to build these capabilities now. So thank you for the question, and please keep them coming.
And with that in mind, it's great that we have that provider perspective. And so as we think about the strategic plays for a health plan, we see three broad buckets that health plans could deliver for a given provider group or health system. So let's start with the first one, trust and engagement. So it is so critical that health plans and providers continue to overcome that historically adversarial positioning and begin and continue to build new levels of trust and collaboration. What will it take? Well, there's an element of building personal relationships that are powered by provider intelligence. And trust is also built through joint investment in new models and approaches when both parties have skin in the game and feel that shared accountability. And finally, by sharing performance data and establishing clear and achievable contracts with providers, health plans can really help deliver against that trust. And Leah, I want to turn to you because I know you've been very focused on hearing from providers on these needs.
Yeah, Peter, that theme really resonates personally for me as a former healthcare provider, and it also did come up quite often in our research as well. So many providers, especially the small and mid-sized providers, they really lack trust in VBC programs because they believe that health plans are prioritizing their profits above partnership and quality of care. So when we asked health plans, or when we asked how health plans could really build this trust, the healthcare organization C-suite often pointed to data transparency. And they talked about how they would like to know how other similar providers are performing on value-based care programs. Because health plans, they collect a tremendous amount of data and they can generate really rich insights that could be shared with providers and could really help them improve their programs and build trust.
That's great. So let's move on to that second one, which is outcomes definition and measurement. So in any incentive plan, it's really critical to have measures that are, number one, understandable, and number one, carry a belief that somebody can achieve them, that they are reasonable stretch targets. And of course, a lot of the models that we've had thus far have been foundational measures around HEDIS and STARS metrics, and those are great. Now, despite a general consensus about the importance of high quality care at a lower cost, many provider organizations are still hesitant to get involved, mainly because they lack trust and clarity on the specific metrics that health plans are putting out there to measure performance. And that leaves them hesitant to continue along that glide path. And so for specialist care, this is a specific and particular barrier. And the health plan and provider struggles to align on metrics that are both within that control of the specialist and have a large enough volume to be valid and attainable. So there's struggles there, and providers also still don't trust that the performance will be measured fairly. And so while the design of the contract needs to be really strong, the collaboration around creating more comfort regarding how the metrics were defined, how a provider can achieve those targets is really important. And so a couple of examples to overcome this: service line specific models, and engaging providers early on in that buy-in process.
Yeah, so collaboration with providers on performance metrics would really go a long way. In our research, we found that many providers lack clarity and transparency into the KPIs used to measure their VBC performance. And they really feel these measures are mainly just dictated to them without much say. And that can put some pressure on them to practice medicine differently. Without plan and provider agreement on these metrics, providers are starting to feel a lack of clinical control, which often really prevents small and mid-sized organizations from increasing their VBC adoption or even taking on any downside risk. And we actually found in our research that providers who have a say in VBC metrics are actually much more likely to stay involved in value-based care and to adopt downside risk. So to really alleviate concerns around trust and transparency, health plans will likely need to align on meaningful metrics, not just any metrics, but meaningful ones that create buy-in with the providers so they feel that the metrics are aligned with the best interests of their patients and their practice.
Excellent. So on top of the contract definition, the outcomes definition, there's also capabilities that are required for providers to succeed in value-based care. And of course, many provider groups, in particular smaller practices, do face some of those capability gaps, whether that be their clinical or technological infrastructure to enable the right reporting, the right measurement success, you name it. And so health plans can really target investments, tailor them to fill those capability and infrastructure gaps to enable that strong performance and population health outcomes that everyone jointly desires.
That's right, Peter. So the IT infrastructure and technical capabilities necessary for successful execution of VBC programs is non-trivial. The support required can range from, data management, technical assistance, care management tools, and payment and billing software, anywhere to recruiting and training personnel to develop and manage the infrastructure. So most small and mid-sized providers really lack these capabilities, and they also lack the funds to pay for their implementation. But health plans can provide financial support for the development of this infrastructure. And really without this support, providers are either not able to get involved in VBC or they struggle to engage efficiently and effectively. So for example, we spoke with the COO of an independently owned multi-specialty practice who noted that he really didn't have a billing or claims adjudication system that was equipped to handle alternative payment models, like a bundled payment, for example. And thus he was required to, quote unquote, rig the system to just make it work. We also talked to a solo practitioner who reported that he actually had to decline several value-based care contracts because frankly, he just didn't have the personnel resources to perform the VBC data tracking duties that were required. So without the proper financial and personnel support to manage these administrative tasks that are really required for VBC success, programs are likely to place a heavy burden on providers that's just really not sustainable.
This all really resonates. Really real challenges out there. But now if we've just talked about what are the most important things that providers need and what could health plans do, how does a health plan translate this into action? Should they provide the same support to all providers in their market or network? No, the next step is figuring out which providers to collaborate with, what their needs are, and how to best engage them. So now we're going to double click on two tangible ideas that we believe are critical in driving the health plan's ability to execute along these lines. The first is the provider intelligence that health plans access to target and prioritize these potential VBC partners. And we see a lot of room for improvement. The kind of one-to-one understanding of needs and opportunities of provider groups doesn't exist today at many health plans. Why? One reason is that oftentimes these insights aren't aggregated at scale, either because they're sitting in the heads of specific employees or just aggregated and spread across different silos of an organization. In the absence of that, even some of the more sophisticated plans often rely on simple internal metrics based on their internal claims experience. Other plans take a basic approach and use any willing provider and kind of respond opportunistically rather than proactively scanning the market for strategic opportunities. Finally, we continually hear from clients about the time and resource intensive process to pull together these packages going into the contract renewal or other VBC negotiations. So we see a big to-do for many health plans to become more systemic, data-driven, and adaptive in their work to understand the provider VBC opportunities. And we'll be sharing some details about that in just a moment. But before we jump there, Peter's going to preview how health plans can take this intelligence and translate it into action on the ground.
Yeah, thank you, Amy. The second opportunity that I'll get into shortly is around the strategic approach that health plans can take to engage providers through a multi-channeled way and deploy enablement strategies through education, tools, and capabilities, clinical transformation consultants that many health plans deploy in the field to partner with providers. So a series of a series of activities that plans can deploy. And we'll talk about how now is a really important and timely moment for health plans to take a look under the hood and optimize this approach, both in a systematic and data-driven way.
So as I was saying, many plans struggle today to obtain those comprehensive insights needed to understand optimal VBC targets. Data sources are fragmented across silos, and the data that's available is very often limited to their own claims experience, which provides an incomplete view of provider performance. So ZS has built a provider intelligence engine prototype, a solution alongside our clients to solve for these specific needs that we're hearing in the market. The screenshots here on the page are of this dashboard prototype. And by the way, we would love to provide a full demo to anyone on the call at a later time. So this is a web-based dynamic dashboard that makes these provider opportunity insights easily accessible to any number of users at a health plan. It aggregates multiple data points about performance, including cost and quality outcomes, VBC readiness and experience indicators, and then benchmarks providers against their markets and national averages to help health plans prioritize where to play. Now, many health plans do have some version of this functionality today, but our perspective is that based on the tools and insights available, either through homegrown solutions or point vendors, many of them lack the visual appeal, intuitiveness, and comprehensiveness to drive the kind of adoption and ease of use to make this part of the day-to-day operations at a health plan. I want to mention this dashboard is also easily configurable and flexible, and we work with clients to adapt the interface to capture metrics that are of specific interest to them or to integrate their own internal claims feeds or other data. So that this can become a really convenient and sophisticated tool to drive provider intelligence at health plans. So to bring this to life, I wanted to share a case study of how this can drive impact. So considering a small regional health plan that's looking to innovate the way we spoke about earlier in this call, to drive collaboration between cardiologist groups and PCPs in a new value-based care model. Now, since they hadn't previously had any cardiology-focused VBC models, their knowledge of the market was somewhat limited and more oriented around traditional fee-for-service, performance, and contract negotiations. So, in early discussions, the leadership team considering this opportunity, would often be inclined to start with maybe the largest groups affiliated with one of the largest health systems and contracting partners in their market. And that makes sense, understandable at first blush for sure. But when they would look into the provider intelligence score for that group, they actually would see that the group is ranked lower than many other mid-sized groups in the market. And double clicking on the reason why, it turns out that it relates to the unfavorable negotiating position given the dynamics and the competitive dynamics of that particular market, as well as fairly limited prior experience in value-based care models and other APMs. Meanwhile, some of the other smaller groups in that market had excellent partnership scores, including high quality and large enough opportunity size to really make them very compelling partners for new collaborative models like this one. So ultimately, users would be able to get to a targeted list of cardiology groups that are strong potential partners and can go into the market in those conversations armed with really actionable insights and the ability to customize conversations to each group based on this intelligence. And we believe this approach puts them in a much more favorable position to be able to ultimately drive the kind of collaborative, trusting relationships that we've been talking about today. So what's the impact of having this advanced intelligence? In the near term, we anticipate decreased admin expenses of this health plan function and increasing trust and quality of the relationships with providers, as mentioned in the example I just shared. And then over time, providers will perform well and be retained in value-based care contracts because of this ability to match the right kind of program and enablement capabilities to the right providers. And with that, we anticipate the kind of outcomes that we're all seeking through value-based care, higher quality care at a lower cost. So let me pause there and ask if there are any questions.
Thanks, Amy. We actually do have a question. What about health plans who have already built in analytics tools and aren't sure if they need an offering like this?
Thank you for the question. Glad to address. So in this scenario, or any scenario where a health plan is looking to be a savvy buyer of enabling capabilities like this one, a great first step can be our provider intelligence diagnostic. And this is a brief analysis where we can benchmark and compare the output of our offering with the insights that a client has available today. And this process helps identify how well the current intelligence may be performing and what gaps are, as well as suggesting ideas that they might, or places where they may want to customize or configure the tool in the future. And based on the output of this diagnostic, we then work with clients to think through next steps that make sense for their unique scenario and needs. Okay, passing it to Peter.
All right, thank you, Amy. Well, really appreciate that overview of provider intelligence, and that feeds right into provider engagement, because having that really strong foundation of intelligence creates the ways and means where we want to optimize provider engagement through VBC. So once that's in place, engagement is the next question, and we think that approach is really critical to not just building trust, but doing so in a way that is, financially advantageous for the health plan and drives the best experience, the desired experience for the provider. So there's several important components to consider to do this. And if you look at the left-hand side of the page, it includes the following building blocks. So of course, there's basic demographics as well as their channel affinity. So that gets into what types of content do they like and through what modalities? Is it digital? Is it in person? Is it something else? And also looking at their affiliations. So of course, there has been a growing trend around providers affiliating with larger systems. So understanding those dynamics is really critical as you think about overall stakeholder mapping from an administrative standpoint down to those practitioners at the, working with patients and engaging with patients on a day-to-day level. And finally, thinking about the geographic planning and personnel placement approach to actually reach providers in the marketplace through teams like clinical transformation consultants and provider engagement personnel, et cetera. And of course, because those teams are people-driven teams, it's a big investment from health plans. And it's one that really is an important face of the health plan to drive impact with providers. So ensuring that this effort is optimized and stays that way is really critical. And so we work with health plans to help them identify and size the right number of clinical and non-clinical staff to design those territories, if you will. Make sure that they are right-sized based on the complexity and sophistication of the providers they engage with. And think about that from an ROI approach as well. This also ensures that health plans can deliver the right engagement that will be most effective given what we know around their VBC score, their channel affinities, and their engagement profile. And so as this engagement model continues to mature, we think there's tremendous opportunities for bi-directional engagement, where there is both push and pull between the health plan and provider, so that we're collecting data and information as well as a health plan to then further optimize the way that we continue to feed information back to the provider. So we think this is an absolutely critical ingredient in building those trusted relationships. It also is very much a sign of the times, given that providers are continuing to engage with other stakeholders through multiple modalities. And so we really think it's the right time to look at the costs, the benefits, what's currently happening with your teams across channels. And through this analysis, we're pretty confident that we can help clients understand those strengths, those gaps, and opportunities to ensure that your engagement models are best reflecting your strategic objectives from a VBC perspective, but also broadly in terms of your partnership aspirations with providers. Let me pause there. Any questions from the audience?
Yep, thanks, Peter. So we do have a question here, and it was mentioned earlier, but how has COVID specifically impacted this idea of provider engagement?
Yeah, I can take that one. This is a very interesting question. And ZS has actually been conducting some ongoing research really throughout the pandemic to understand how it's shifting patient and provider preferences and also their behaviors. So our most recent study included almost 1,300 stakeholders and really suggests that the about 20% increase in virtual visits will be sustained. So this means that providers will be less accessible in person than they were before the pandemic. And we think this change in behavior will translate to how providers interact with their other partners in healthcare, meaning that general face-to-face time with providers will continue to be at about 70 to 80% of its pre-COVID level. And then also, almost half of providers in our survey meaningfully increased engagement levels via digital push and digital pull channels, like Peter was talking about. So, what does this mean? I think it's clear that it will be important to use a multi-channel approach to engage providers on VBC. And preferences will vary, of course, which makes it critical to track healthcare provider channel affinity to really maintain meaningful interactions with our healthcare providers.
Yeah, thank you, Leah. I think it just reinforces everything that was mentioned previously.
Great. So to wrap us up, we've just done a deep dive on 2 examples related to provider intelligence and engagement. But we wanted to take a step back and look at the broader context, There are a number of imperatives that leading health plans need to drive, and many of them are driving in order to advance value-based care. This page provides a summary of every of those needs, everything from assessing the current VBC portfolio to internal facing strategy, external program deployment, and the critical technology and infrastructure that enables both. And with that, we hope you enjoyed today's discussion. We would love to continue connecting with you one-on-one to discuss your VBC priorities and challenges, whether about provider intelligence, engagement, or any other topic. Thank you again for your time and hope you have a great rest of your day.
Thank you.
Thank you.
Excellent. Thank you all so much. This was a great presentation, and a big thank you to our audience. And again, for those live attendees, lunch is on us this time. So don't forget to check out the great related content we have for you. Any questions we didn't answer today, we will follow up. Peter, Amy, Leah, this was awesome. Thank you so much, and we'll talk to you guys soon.